confidence and communication strategy panel. We have such a lovely group of panelists going to be speaking with us today. Quick housekeeping announcement, we do have interpretation. Sí tenemos interpretación hoy a español. Si guste usar la interpretación, hay un círculo, un globo ahí abajo que dice español o dice interpretación y puede elegir eso y elegir español y allí puede encontrar la interpretación. So that if you need interpretation, you can click that down on the bottom. We are also going to be live streaming on Facebook. So it will be occasionally showing people's faces. If you don't want your face on our Facebook stream, you can go ahead and turn off your video. Otherwise, you might pop up on our NCFH Facebook today. But thank you so much for being with us. We are so grateful that you are here today. Like I said, we have a really wonderful group and we don't have a ton of time. So without too much delay, I'm going to go ahead and get us started. Our objectives for today really are to talk about kind of our key communication challenges around farm worker communities and vaccine hesitancy. What are some of the strategies that have been working for folks? What are the ways that people are communicating with folks that have been effective over the last few months? And what are some of the missteps that we want to avoid? So we're going to be covering all of that in the next hour. These are probably a little too hard for you to read quickly on this slide, but I wanted them here so I can share them with you later. And I'll be introducing each of our panelists individually as it is their turn. So with that, I am going to go ahead and introduce Ed. Ed Kissam is going to be our first speaker today. Ed has led research on farm worker and immigrant issues for many years. He is a trustee of the WKF Charitable Giving Fund, which supports a range of local immigrant integration initiatives, as well as policy analysis and advocacy at the national level. Since the beginning of the pandemic, he has focused on advocacy about public health strategies to effectively respond to COVID-19 in farm worker communities. And Ed is going to kick us off this afternoon with an overview of communication strategies around vaccination for farm worker communities. So Ed, the floor is yours.
Great. Good afternoon. And I'm just going to launch into it because I too am looking forward to hearing our friends and colleagues share all of their experience and insights with you. But just to start off, this image of the braided web is correct, which is that there are a lot of intertwined issues that go together in communicating effectively in order to get farm workers and their families vaccinated. So Paige, if we could go to the first slide, that would be great. I wanted to start by highlighting these two terms that keep on coming up in the discussion about all of this, which are vaccine hesitancy versus vaccine accessibility and what the implications are. And the reality is they're both problems, but in many ways, there's reasons to believe that access to vaccination is an even bigger problem than hesitancy. One of the interesting issues is that survey data shows that a key factor that affects confidence, enthusiasm of potential vaccinees and actually going ahead to get vaccinated is that a friend or family member has gotten vaccinated. So part of the marketing is this issue of customer experience, which I'm going to talk about later. So the real issue is that if we can make vaccination more accessible, then it's possible to focus our messaging on the real key issue, which is bolstering people's aspirations to actually get oneself, their families, or their friends vaccinated. So Paige, can we go to the next slide? It's important in thinking about these issues that messaging about COVID-19 vaccination is just one of many strands of information flow in a really crowded and overcrowded messaging ecosystem. Farm worker families are like everyone else in the 21st century in that they swim in this turbulent river of competing messages. So therefore, it's important to get their attention. It's a really key first step. Trusted voices are necessary to get the audience, farm worker families, to listen, but they're not sufficient to have an impact unless they do something special. And what that special contribution is and special attention getting effort is, I think, is to actually have messengers about why people should get vaccinated take on roles as active and effective problem solvers to make vaccination easy and friendly. And they also can spread the word as community counselors and connectors. So messages from people like me, to people like me in the farm worker community, are key in persuasion. And you can see some great examples of that in the videos that National Center for Farm Worker Health has done of farm workers talking about why they got vaccinated. So social network dialogue about aspirations is really crucial because it transforms interest, hope into action. So can we go to the next slide page? At the same time, I think we go astray if we take too seriously our talk about the farm worker community, because the reality is there are many farm worker communities and they're diverse, lots of neighborhoods in a single large community. So special efforts are really needed to actually avoid this tendency of preaching to the choir and taking special efforts to reach out to these outliers in the community. One thing I wanted to suggest, given that there's a lot of talk about youth and young adults being the least willing to get vaccinated, is that in fact, many of them are willing to get vaccinated, and they're really important influencers in talking with their Mexican-born parents, who often rely on their teenage and young adult children who have grown up here as very trusted sources of information. By the same token, agricultural employers and farm labor contractors are really important influencers in the community. Some may already be trusted voices and facilitators, others may not. Part of the challenge, I think, is to recruit farm labor contractors and ag employers who aren't currently very engaged in working to get families vaccinated, to get them involved. So let's go to the next slide page. You know, there's been a big problem in our experience with the pandemic to date when it's framed as a public health problem, because it's actually much bigger and more encompassing than being a public health problem. It's really a community problem. And the implication of that is that the solution to this huge overarching problem is to mobilize a whole range of community activists and institutions. And I really want to urge all of you to think about innovative ways to work with some of these groups that haven't yet been so involved, some of which have a bit, and so on. And that's the consulados moviles, which are really important. With local schools, there's always an elementary school pretty close to where people are. Tienditas, the little stores that everyone goes to, notarios, raiteros, mayordomos, and farm labor contractors. For example, the mayordomos are really key communicators in virtually every farm worker community. And similarly, in those where there are clubes de oriundos, they have a real ability to influence people who are themselves influencers. So the real challenge is to build community conversation which is sustainable. And it's practically going to be really important in the next phase of vaccination outreach, which is to get the children in farm worker families vaccinated in the coming months. If you go to the next slide, please. So one of the reasons to focus not just on the current immediate goal of getting as many farm workers and family members who are eligible vaccinated is it's likely that one-time COVID-19 vaccination won't be enough. And there are variants of concerns. And there's a very particularly challenging thing, I think, in messaging to farm workers who have been infected with COVID-19. Prevalence of COVID-19 in farm worker communities is really extremely high, maybe in the 20–30% range. And they may well think, for quite reasonable reasons, that they're okay. But actually what we've learned, what scientists have learned, is that vaccination generates much higher levels of immunity than simply natural immunity. So it's going to be important to maybe do special messaging for them. Let's go on to the next slide page. So I just wanted to wind up saying that it's been exciting so far to be hearing what is working. And I really want to finish up by just saying that we have to focus on this being a marathon, not a sprint, that our work in communicating about vaccination and also about other aspects of COVID-19 response is going to go on for a long time. So I'm really proud to turn it over to our friends who are actually doing the hard work in the real world. And Irene, Samuel, and Sergio. And I just would like to end in saying that one of the real concerns to keep in mind also is that this whole issue of vaccinations has become tremendously politicized. And groups like Voto Latino and Mi Familia Vota, who are actually working mostly on civic activism in Latino communities, are really important allies. So I hope as time goes forward, we'll be able to collaborate with them also. So thanks a lot. And onward to our other marvelous panelists. And I just left some references for you all.
All right, thank you so much, Ed. If anybody has questions already, please drop them in the chat, and we're going to do a Q&A session after all of our panelists have had a chance to talk. So please leave them there, and we'll get back to them a little bit later. And I've gotten some questions already. We will be sharing all of these slides later on. There's so much good information and everything that's being shared today. So we will be emailing those out. So our next speaker is Irene Barraicua. Irene is a public relations communication manager for Lideres Campesinas, which works to strengthen the leadership of women farm workers so that they can be agents of economic, social, and political change to advance their human rights. She's a longtime activist, advocate, researcher, and filmmaker, and much of her passion and work has revolved around accessibility to healthcare, especially for impoverished and indigenous communities. Today, she's going to discuss the work that Lideres Campesinas has been doing to counter misinformation and to bolster confidence among California farm workers. So Irene, the floor is yours. Oh, you are muted still. There you go.
Sorry about that. All right, thank you very much. Appreciate the welcome, and also being able to listen to Ed Kissam, who I respect very much, his expertise, and having been working with him throughout the COVID-19 pandemic. So definitely, it's an honor to follow his presentation. And I'll start by, like you mentioned, we sort of presenting what Lideres Campesinas is. So we are a community-based organization. We are a network of women farm worker leaders and their families. And throughout this pandemic, it has truly shown its incredible value and power that during this time of a crisis, being able to stay tuned with the community, knowing what the needs are, right? We've been able to really respond. And now with the topic of today with vaccines and farm workers, responding to vaccine hesitancy, right? Different fears that exist has been a big part of our work right now. Let me see, I'm trying to see if I could control this. Okay. So two major concerns that we have found with farm workers in relation to the vaccine is health concerns such as paralysis and death, and then the costs incurred when someone gets sick, and of course, always fear of immigration. Things have changed a little bit with the new administration, but that still continues to be a fear because it's sort of embedded in people's minds, right? And I'm going to also go over here some of the work of Lideres Campesinas before and after the vaccine. So we've been really, during this pandemic, dedicated to building coalitions, advocating also for agricultural workers to be prioritized for the vaccine, making sure that we as an organization and as trusted messengers are well educated ourselves, right? And in tune with how the community feels, and being able to share that information with our partners and experts in the health industry, right? And public health in general. And battling misinformation has been a huge task as well. Education and advocating for a worker-centered approach to worksite vaccination clinics. Also outreach and hosting and organizing vaccine clinics. We would have imagined having a role in this, but that's what we're doing till this day, is actually hosting these clinics. And then resource navigation is an incredibly important element to have at these worksite clinics. And so that's a big part of what Lideres Campesinas has been doing, both at clinics and in the community, right? I'm not sure why don't seem to be able to control this very well. Okay. So of course, we know that health concerns are truly an issue with farm workers. Over 60% of farm workers are uninsured. Also, according to UC Merced, the farm worker profile shows that 28% live below the poverty line. Also, more than half of farm workers in California are undocumented. So taking this into consideration, Lideres Campesinas and partner organizations have done the following in order to respond. First off, at the beginning of the pandemic, what we did, and it's still very relevant because it mapped out our work for us, is we wrote a letter to the governor and first partner, Jennifer Newsom. A part of this was identifying 8 major concerns with farm workers. And we see till this day how relevant this is, because without, for instance, our first concern was lack of education regarding COVID-19, right? Lack of healthcare. When we have these issues, then it's really hard to reach out to the population that hasn't, there's no trust where trust hasn't been earned yet. And so really addressing these concerns at the beginning about this work. And so one of the big initiatives that we took on was to build coalitions. And so today we are excited and honored to be a part of several coalitions, more than what is pictured here. The Cura Project in Sonoma is responding to the COVID-19 pandemic with resource navigation, right now with vaccine outreach. The United Against COVID Coalition in Kern County, is another coalition we're a part of in order to host vaccine clinics, COVID education on the fields, as well as in Coachella, the Equity Project. We've been participating tremendously with testing, as well as vaccine clinics and outreach in the community. The Vida Project in Monterey is another one where we have been doing resource navigation clinics that we're hosting. And we're also honored to be a part of the Together Toward Health initiative through the state of California and the Public Health Institute, which is really aimed towards reducing vaccine hesitancy and education and outreach, right? And then also, of course, the Orale Project. This is where we do rapid testing and still encouraging to the community that rapid testing is, and testing in general is very important, right? As well as at the same time giving about the vaccine in these settings. And so the way that we do a lot of our outreach is even Ed Kissam presented in his presentation, is making leaders out of mayordomos, which are supervisors, contratistas, contractors, and coming to the fields and actually giving an education. Because not only do we advocate for equity in the number of vaccinations that are given, but equity in the way that this is approached, right? We feel that one person that rejects the vaccine is too much. And so we rather go to the fields first or to the community and encourage and educate before that the vaccine is maybe brought to them if they are lucky, right? But so making sure that we reduce that hesitancy before the opportunity comes, and building those leaders and examples and influencers within the actual work sites and community. So this has been really exciting, is partnering with different healthcare professionals. You could see in the left here, this is with Dr. Tomaso in Ventura with the Ventura County Health Department. Here in the middle up top, we have Dr. Joaquin Arambula, an assembly member. It was an honor in Fresno to visit fields with him as well and do education. On the right, we have Adventist Health in Kern County. On the bottom right, we have Dr. Romero from Natividad. And then we have Clinica Sierra Vista on the left bottom over here in Kern County as well. And so that's been really an exciting part of our work. And it's very important because of that fear, right, that we mentioned, fear of costs incurred and fear of immigration. Many people still are scared to go to regular county clinics to get the vaccine. And so that's something that we're really addressing. Here's a picture of Suget Lopez, our executive director. We have also many photos like this and videos of farm workers who are also leaders. She's our leader, right? And well, our whole organization is composed of leaders, but it was exciting for Suget Lopez, executive director, to have just gotten her vaccine last week. But we tend to share a lot of this on social media, all of our own staff, getting the vaccine. And that was a big part of this also, is in these coalitions, we also, as participants and as community health workers, we were able to get the vaccine early on as well. And so aside from also advocating for farm workers to be a priority, many of what we advocated was for community health workers as well to be prioritized. And so we know that our members, for instance, come from the actual communities that are the most impacted. And so this has been another beautiful thing, is creating more community health workers that are from within the community, right? I know many were advocating for this community-based contact tracing early on, and seeing that how important it really is in order to reduce vaccine hesitancy. So again, going to laundromats, going to little stores, going to testing sites and registering people, out to the parks, setting up tables are all examples. And so a part of what we did once agricultural workers were prioritized is we did write a letter to the governor just in order to, make sure, assure that there are guidelines and standards, right? Because as community leaders and having experienced the vaccine ourselves, we know the reality is that there are some side effects to especially the second vaccine when you do the 2 doses, right? And so we really wanted to experience it ourselves and be true to what we were advocating for. And so making sure that we did pressure perhaps Cal OSHA, Department of Labor, to come up with some guidelines, right? For some sick time, paid sick time for farm workers, because losing 1 day of work for a farm worker is a lot of money, right? It's a lot of time that they're losing out on. And so that is something that we advocated for, as well as good education about the vaccine. And so part of that was also emphasizing the need for community-based organizations to be involved in these vaccine clinics, to be present at the work sites or also in the community ones. Because we also don't want people to feel forced to get the vaccine at work if maybe they're not comfortable. However, that also has been a convenient approach for many reasons. And so, so yeah, you could see much more of our work on our website and on our social media. And I truly appreciate the time, you know, that you gave us here to present on this topic. Thank you.
Thank you so much, Irene. There are some really great questions in the chat, so I am making note of all of those so we can come back to them after all four of our panelists have had a chance to go. Y sé que hay algunos nuevos que han llegado, entonces si necesitan interpretación a español, pueden elegir el buzón abajo que dice interpretación. Just a quick interpretation reminder. All right, our next speaker today is Samuel Orozco. Samuel is the founding executive producer for Noticiero Latino en Línea Abierta and has been the director of Radio Bilingue's News and Information Department for nearly 40 years, supervising all national programming. In 1996, he was a Henry J. Kaiser Family Foundation Fellow, investigating emerging cultural competency standards for mental health and developing a recognized health journalism beat for Radio Bilingue. He was the oral historian for the books To the Promised Land and Organizing for Our Lives, New Voices from Rural Communities. Samuel will be talking today about current vaccine misinformation and his helpful dialogues that he's having through radio with agricultural workers. So adelante, Samuel. Oh, you are still muted, Samuel.
Can you hear me? Okay, well, muchas gracias, Paige, and gracias muchas también al National Center for Farmworker Health. Es un honor muy grande estar en la grata compañía de este distinguido panel, en este foro, y de amigos y compañeras en esta causa común de los trabajadores del campo. Debo decir de que Radio Bilingüe es un servicio nacional que sirve a comunidades agrícolas prácticamente en todos los mayores valles agrícolas del país, desde el Yakima, Skagit, en Washington, Willamette, Oregon, en California, el Valle Central, Salinas, Imperial, el Valle de San Luis en Colorado, el Valle del Río Grande en Texas. Así que un saludo muy grande a todas nuestras audiencias, donde quiera que nos oigan. Espero que estén en sintonía. Se me ha pedido que hable acerca de la experiencia del servicio de Radio Bilingüe al cubrir la pandemia, la emergencia de salud pública de la pandemia durante estos meses. Let me start this conversation by going back for just a moment to the early days of the pandemic, and that was January of last year. After the World Health Organization, the WHO, announced a mysterious virus disease, and the CDC confirmed the first cases of coronavirus in the US. And some of the first reported cases were too close to home, California and Washington State. We set out to report about it in a serious way. We didn't want to get the story wrong, and so we decided to go directly to the source, to the WHO and the CDC. After repeated requests, we were not able to get Spanish-speaking experts from these agencies. So we booked experts on global health, we booked epidemiologists, virologists from UCSF and other respected institutions. And that's how we began getting some light about the virus, basically by reporting on the best of the science on the air. We wanted to know how serious the new disease was and what to do about it. Eventually, as the virus spread and was declared a pandemic and a public health emergency, we felt the urgency to step up our rapid response news service. We dedicated most of our conversations to the emergency, and we also launched the top of the hour Despacho, un despacho noticioso providing practical information to especially to essential workers, the people who were most exposed to the virus, reporting on the latest news about how the virus spread indoor and outdoors, the first known symptoms, the latest guidelines to stay safe, the first discussions about wearing a face mask, the ways to keep social distancing, and also the ways to sanitize, the challenges of staying at home for many of us. Then we reported on the challenges to provide easy to get COVID testing and timely results, which at some point was a major point of debates and discussions. And also reported on counties with best practices of contact tracing, which was also a challenge, especially for immigrant workers, and the challenge to get immigrants to trust the healthcare workers, the promotoras de salud, to do that contact tracing. Soon, as the pandemic rapidly spread in our communities, we focused our reporting on the hotspots, the barrios of New York, the barrios of Los Angeles, and the farm working communities in Yakima, in Washington, and also in the Central Valley became a hotspot of the pandemic. We reported about the devastating infection, the hospitalization and death rates in the Latino communities, and on what some call the historic decimation of the Latino communities, the decimation of entire generations in our community. We wanted to make sure that our audience had a good picture about the threat, about the risks we faced as a community, especially those at the highest risk, those people who were working in jobs considered essential. And we felt the need to better report on the hotspots of the pandemic and also on the alarming threats to our communities, especially after realizing about the growing influence in our community of a new epidemic. And that was the outbreak of dangerous rumors, of false rumors, what the WHO called the infodemia, the misinformation coming in the US from the highest political circles, the circles of power in Washington, but also coming from powerful social media influencers south of the border. We hadn't seen in the past, as in Radio Bilingue, something like this, which is this confluence of bilingual misinformation, both in Spanish and also in English, campaigns, orchestrated campaigns like these ones coming together in the times of a pandemic and a political season. And those misinformation campaigns set out to downplay the threat of the virus and encourage people to continue business as usual. So they called the pandemic a political invention, a disease of the rich people. They pushed miracle remedies such as chloroquina or gárgaras de sal or gotas de cloro, and they mocked or made fun of those who wore face masks and followed social distancing rules. So that was the challenge. Encountering the damaging impact of those unfounded rumors has been a challenge up to this day, up to today. One of the fronts of our coverage has included reporting on the politics of the pandemic, the reluctance to invest on the combat of the pandemic, the lack of resources to frontline workers, the resistance to give access to healthcare to the people who are most at risk, the inequities also in COVID testing and COVID vaccine distribution, the access to testing and treatments in low-income communities. And our reporting and our conversations on the air are geared to involve the listener as an active citizen in the public decision-making process, getting listeners into the public conversation about the right to receive fair protection against the pandemic. So now that we are entering into a new stage in the pandemic, which is a stage of widespread vaccine distribution, we continue facing similar challenges to get our paisanos and to get our familias to get the shot. Ironically, while in the early days of the pandemic, we had to make people aware about the dangers they were facing, because of the virus and because of the underestimation of the threat of the virus, these days the conversation has switched and has to deal primarily with the low risk of the vaccine. Bad news usually get amplified in the minds of the media consumers. And when someone dies and the death is linked to the vaccine, people become suspicious and people become fearful of dying, which is the case in some among some in our audiences these days, especially when they don't have a consistent supply of news in their own language that they can rely on. And serious news and explanations in Spanish are not easy to get in the media, and especially in radio and television these days. We've been approaching our coverage by displaying the power of storytelling whenever possible, whenever our resources permit. So telling the story of the farm worker who died of COVID in Hanford in recent days after underestimating the seriousness of his symptoms and continuing showing up to work, or the nurse who called in from Santa Maria and who managed to find 37 positive cases in just one crew after some contact tracing, or the pioneering efforts in Riverside to vaccinate workers in the fields. All those stories have gone on the air again in an effort to illustrate and to encourage people to get engaged in the conversation. At the same time, we also value the calls from listeners who share stories on the air with their peers about how they manage COVID outbreaks within their families, what they do to protect themselves, the discussions they have with their fellow workers, the deceiving information they report when they find it in WhatsApp or when they find it online. Y pues, como decimos nosotros, no hay como saber lo que le pasó al vecino, lo que le pasó al colega, al compañero estudiante, al pariente o al compadre, para entender mejor las cosas. Así es que aquí le voy a parar. Solamente quisiera enfatizar el hecho de cómo en Radio Bilingüe, básicamente durante estos meses, nuestro acercamiento a la cobertura de la pandemia ha consistido en, número uno, tratar de proveer lo último que nos ofrece la ciencia con relación a la pandemia, mantener a nuestra gente informada sobre lo último que nos dan los científicos con relación a la pandemia. Número dos, elevar el nivel de preocupación, el nivel de alerta de parte de nuestra gente sobre la seriedad y los peligros que nos acechan como comunidad, porque nosotros somos los que estamos pagando la peor cuota de la pandemia. Elevar conciencia sobre eso y bajar además el nivel de complacencia al respecto. Número tres, igualmente reportar sobre la política de fondo, el hecho de que pues hay actores políticos, hay sectores políticos interesados de alguna forma en coartar nuestros derechos, envolver a nuestra gente como ciudadano en esa conversación de la política sobre el uso de los recursos públicos. Y número cuatro, pues tomar acción, alentar a nuestra gente a tomar acción viendo las cosas como comunidad, orientados como comunidad, pensando en familia, pensando en comunidad primero, ¿no? Viendo la cuestión del uso de las mascarillas, la cuestión de las vacunas como un acto de solidaridad comunitario en primer lugar, y todo esto igualmente lo hemos hecho en colaboración con cantidad de aliados nuestros en la comunidad campesina, aliados nuestros en la comunidad médica, proyectos como el que representa el doctor Sergio Aguilar-Gaxiola, Órale, y otras colaboraciones más, colaboraciones mediáticas. Tenemos una gran colaboración de medios en el Valle Central de California. Todo esto en el ánimo de amplificar, magnificar estos mensajes de los que acabo de comentar. Así que ahí le paro y con todo gusto responderé a preguntas o comentarios.
Thank you so much, Samuel. We are now going to go to our last panelist, who I think will also be speaking a little bit, switching back in English and Spanish. So if you don't speak Spanish, you can also click the interpretation button and click the English channel. And our amazing interpreter, Edith, will be switching back and forth there. So without further ado, let me introduce Sergio. Sergio Aguilar-Gaxiola is a professor of clinical internal medicine at the School of Medicine at the University of California, Davis. He is the founding director of the Center for Reducing Health Disparities at UC Davis Health and the director of the Community Engagement Program of the UCD Clinical Translational Science Center. He was recently appointed to the California COVID-19 Vaccine Drafting Guidelines Work Group with the charge of drafting guidelines for the prioritization of supplies of available COVID-19 vaccines. He's a national and international expert on health and mental health comorbidities on diverse populations. And today he will be wrapping up our panel by reiterating some of the big picture themes and highlighting the importance of regular dialogue and feedback with and from farm worker communities. So go right ahead, Sergio.
Thank you so much, Paige. ¿Me escuchan?
Can you hear me?
Órale, Samuel.
Good. And órale, Samuel.
I'm so pleased to be in this panel because I admire Ed, Irene, and Samuel, and have known Ed and Samuel for over 2 decades. And compañeros de batallas.
They are battle partners of several battles, and certainly this is one of the important battles.
So what I'm going to do here is to bring an angle that is often neglected or not discussed. And this is the angle. If we are depressed or if we are anxious, I mean, with severe anxiety or both, it's difficult to have confidence on anything. Certainly it's difficult to make a decision to be vaccinated. And even further, to go to places to get vaccinated. And that's the angle that I would like to discuss with you. Because one of the big challenges for farm workers, and we have known this for decades, is that when they need mental health services, in this case, they really don't have access to the services. So let me take you briefly about what is the situation before COVID-19. And this shows you the pervasive social and structural inequities. And this, I hope that you don't get lost in these bars here, but this is data, national data on Latinos, on Hispanics. And what I want to bring your attention is to focus on the bar enclosed by the circle. This says that if someone, that those who have co-occurring any mental illness and substance abuse or substance use disorders who are 18 or more, 93% of those in those categories didn't receive treatment in the past year. This is back in 2018, 2019. Okay, this is national data. You have the references there. So there is what we call a treatment gap, important treatment gap. I conducted with many colleagues this study in the Central Valley in California, in Fresno County. It was a county-wide study, over 4,000 interviews funded by NIH. And we call it the Mexican-American Prevalence and Services Survey. And what we reported is that of those who receive care, and they received care because they had 12-month mental disorders, 1 or more. 1 of 3 of the US born, and this is with Mexican origin adults, okay? 18 and older. 1/3 of the US born received care. 1 out of 6 of the immigrants, those who were born in Mexico, and less than 1 in 10 of the agricultural workers. That was back in the middle of the 90s. Do you remember that, Samuel? I had several interviews with you about that. You were Radio Bilingue, Hugo and you and Maria Irene and several others played a key role in disseminating this information, keeping the public informed. But I just want to give you a sense. Well, this is what we have been, the nation has been experiencing during COVID-19. And this is just a little glimpse of the impact of COVID-19 on mental health. This is a survey by the CDC, and these were adults older than 18. And what you see there, 41% of respondents reported at least one adverse mental health condition. Anxiety or depressive disorders had the higher percentage, 31%. That is very high, by the way, you know, when you compare it with the previous years. Trauma, you know, increased substance abuse. But listen to this. Seriously considered suicide in the past 30 days before the survey. About 11% were in that in that group. And even more disturbing is that suicide was higher on the age group of 18 to 24 years of age. And as you can see there, but not only that, it happened also in Hispanics, more than in other population. And look at essential workers also, you know, over 20%, 22%. The other thing that we know during the pandemic is that symptoms of depression have risen threefold since the pandemic began. And also poor mental health is associated with other risk factors for well-being. This is a study, comes from a study that our colleague Brenda Skenazy from UC Berkeley did, along with several other colleagues in Monterey County in California, in the Salinas Valley. And she interviewed farm workers. This was focused on farm workers, over 1,100 farm workers. And what she reported is that these symptoms, the percentage with symptoms of anxiety and symptoms of depression, okay? It is very high, very high. I won't focus on the other issues that they found, but it's just to illustrate that this is a very recent data, by the way. So some things that I think are important that we keep in mind, and thank you, Ed, for sharing with me this information that resonated so much with me, is, you know, one of the, and I'll speak about that in a couple of minutes, that farm workers have been heavily hit with COVID, and also the losses due to COVID had been considerable as well. So if the primary breadwinner falls ill, this initiates a cascade of crises in the family functioning. Things like happen is, you know, who provides childcare? Also, do teenage students need to work? What if the husband and the wife are both ill, as it has happened, especially in those living in crowded housing? If a breadwinner is ill, who cares for them if other family members have to search for work, as it is happening? And if any family member is seriously ill and hospitalized, how about paying for the medical expenses, given that farm workers are way, way underinsured or non-insured? And so there is this cascade that I want to bring to your attention, from an individual crisis to a family crisis, to a social network crisis, the circle of friends and compañeros de trabajo, a community crisis. So there is this cascade of psychological stressors in farm workers and their communities. And this, you know, this can become a spiral upward that puts farm workers into crisis. And yet, little is known about the true impact, because treatment is so difficult to access, as I exemplify with that data. This is very, very recent. It was published last week, at the beginning of last week. And the documentation, they documented that the mortality ratio for foreign-born Latinos in that age group, 20 to 64 years old, and this is with high school or less, is 11 times the COVID-19 death rate for whites, 11 times. And this is very much related to factors such as workplace exposure, which is the population that we're talking about here, our farm workers. So there is a lot of losses, and we have to deal with those losses currently. Very, very challenging especially for the families that have experienced losses. And there is a recent article also that documented that for one loss, there are at least 9 people who are directly impacted. I mean, importantly impacted. There is this other paper that shows that the risk of death, for essential workers in food and agriculture is 1.4 times higher than the overall population from 18 to 65. And we suspect, this is something that we have discussed with Ed and others, Rick Mines and others, that farm workers likely to be even higher than the rest of the sector. So the mental health burden of COVID-19 includes grief over the death of loved ones, the coworkers, friends, and neighbors. With losses, there is a strong association with depression and with anxiety and substance abuse as well. And this is happening at all levels, individual, family, and the community level as well. So let me share this these voices that Irene very kindly shared with me of the fantastic job that they are doing listening to farm workers across the state of California. One is las personas con el virus están pasando.
People with the virus are going through a lot of stress and depression, and even the thought that the entire family is going to die because of it. They do not want to see their children suffer with the pain that the virus causes. In the community and in these families, they are starting to see the effect that the coronavirus is causing: stress, depression, traumas, loss of family, everything that can lead to a suicide, violence, and crime. A few weeks ago, I spoke to somebody. Their cousin died because of suicide. Also, the family was exposed to COVID, and everybody suffers depression and anxiety. This family has a great concern because of the vaccine, because they take different medications to get out of this pandemic. There's a lot of worry because there are people that are suffering depression. The concern is now about the vaccines, whether they are safe or not safe for the people. The students are suffering because of COVID, because they are struggling with their classes.
And this is an important consideration because we already have data, and I think that this is the tip of the iceberg of the negative impact on the mental health of youth that COVID is having. And certainly this happens to the farm workers' kids. Hay mucho estrés en la juventud por no estar.
There's a lot of stress in the youth for not being in a classroom because of the concern that somebody in the family will get contagious and they will lose a loved one because of the virus, and also because of being locked up at home for being in virtual classes. It is very stressing for the teachers that sometimes don't have a lot of patience for the homework that they leave, and because of the internet service that very many times is not good. There are also young people who do not have a job, that lost their few hours of work that they had because of the virus. Now they don't have how to pay their cars or how to pay for their expenses. But the health programs are not enough.
Need to be considered in vaccine acceptance. And this is something that we cannot continue to neglect. And the messaging and communication that we are, crafting for farm workers' acceptance of the vaccine ought to consider, once again, mental health issues. Thank you so much.
Thank you so much, Sergio. And let's do a virtual round of applause for our 4 esteemed panelists. This was really wonderful and incredible information. We have lots of good questions in the chat, so trying to pick a couple for the 5 or so minutes that we have left. Oh, thank you, Rick, for the actual applause from your video. Thank y'all. So I want to start with one of the first questions that came in, which was, at this time, what are farm workers most interested in knowing, and what information is still missing or are they not getting? And I'll let any of y'all go first who wants to tackle that question. Samuel, I saw you unmute first.
I'm sorry, but my computer got frozen. The internet connection got frozen. Can you repeat the question?
I'd be happy to. At this time, what are farm workers most interested in knowing, and what information are they not getting? So what's the information gap?
Mm-hmm. Well, at this point, we believe, number one, vaccine safety and vaccine availability. That's one issue that I think it's in top of people's minds. At this point, what I'm seeing little by little is a change in the attitude of many people, in the sense that when they are seeing their fellow workers, their compadres or their friends get vaccinated, little by little, we're seeing a trend to people accepting the idea of going out and seeking the vaccine. But still, I think the issue of vaccine safety and how available it is, how accessible, if they have the right to get it, I think that's one top issue, and I will stop there.
Thank you, Samuel. Irene?
Yes, I'd say also just more education, right? More information is in regards to maybe there's a big population of farm workers that maybe feel that they don't get sick, that they don't need to get the vaccine because it may make them get sick. And so just some more information as to the importance of herd immunity, right? And why that they should get it. Also, if they were to have some sort of reaction, what would their options be? And in terms of healthcare and such.
Great.
Yeah.
So great. A quick plug, in CFH has developed some really great flyers with answers to a lot of these questions on them. So Bethany, maybe you can put that link in the chat, because I think a lot of those questions are answered on our really neat looking flyers that we've developed recently. So I want to make sure we get to this question with our 2 minutes that are left, because this is a hot topic right now. What type of arguments and counter arguments have been efficient regarding hesitancy because of the Johnson & Johnson pause? So the pause in administration of Johnson & Johnson. How much are y'all seeing hesitancy around that, and how are you talking to folks about it?
Well,
I can take that one. But any of our compañeros la puede contestar. Well, this is, as you know, Johnson & Johnson is on hold because of the blood clots association that was reported. And we're talking about out of 6.8 million people who was vaccinated so far in the US, 6 women, actually 18 to 48 years of age, develop these blood clots. One of them is reported to have died. And there is a very deep investigation being done by the CDC in trying to figure out what to make out of that. And one of the things is, you know, and I don't want to get too technical on this, but is to try to ascertain, you know, to what extent indeed those complications have been related to specifically to the Johnson & Johnson vaccine, because contamination with the AstraZeneca, all of these things. But the bottom line on here is that to what extent, you know, the reports of the J&J vaccine are bad news, you know, for vaccine acceptance, especially for farm workers. There is no data that I can think of yet, and I have spoken with several people about whether has been hindered, you know, the confidence that farm workers have had. I have heard that some prefer not to do it, but I have heard also that that they would like to do it, you know, that but I think that the message that we ought to transmit is that, you know, risk-benefit ratios, you know, what is the risk of developing even something that is serious as blood clots versus the benefits of being vaccinated? And for me, it's very clear. You know, I think that the likelihood to get infected, get hospitalized, and die is much, much, much higher if people get not vaccinated with the J&J vaccine than if they do. So the message from my perspective is, when the hold is lifted, is get vaccinated. There are tremendous advantages for you know, for being vaccinated with J&J. And one a misled information is that because of the efficacy of the J&J vaccine, about 72% in the US, that many people think, wow, 30% you know, stand to be infected. And that is not the case. That is not the case. Actually, it's in reality is 1%. And of those who get infected, get mild infections. You know, it prevents hospitalizations and it prevents deaths, almost at 100, except the one case that we still don't know the extent to what that is associated with J&J. And I'm sorry to have been so. I'm very passionate about this.
Well, moving forward in our new service, I think our approach would be, in terms of the J&J vaccine, to get on the air trusted voices like Dr. Aguilar-Gaxiola's, providing this statistical analysis, and B, getting on the air the voice of those who have already received the shot and basically providing their testimony.
Yeah, that's great. And Irene, did you want to add anything before we wrap up? Or Ed?
I was just going to say, you know, we did administer thousands of Johnson & Johnson vaccine right when the news came out, and overall people have been still positive about getting the other vaccines, but of course there's always some fears right involved. So you do get a lot of calls regarding, you know, people start thinking they're getting reactions, and so just making sure again that we have a resource for them to ask questions. But yes, thank you to Dr. Sergio for explaining all of that.
Yeah, thank you. And Ed, did you want to add anything to either of the questions?
I just add something that I actually heard from Irene, which is that it's really important not just to think about getting people vaccinated, but having them feel good about being vaccinated and confident, so they can then spread the word to family, friends, and neighbors to be vaccinated. So Irene was telling us about Lideres Campesinas' work in informing people who are lined up to get vaccinated, who've made the right decision, to help them become better messengers to others about why they're doing it, why it's safe, and why it's important.
Thank you so much. Thank you so much to all of our incredible panelists today, Ed, Sergio, Samuel, Irene. We will be sending out the PowerPoint as well as a link to an evaluation survey. We'd love to hear your feedback about today's presentation and what you would like to see from us in the future. Bethany also shared the link to kind of our clearinghouse of resources, both ones that we've created in CFH and ones that we have found useful from other great organizations. So just wanted to say another thank you again to our panelists and to all of you for attending. And we hope to see you at future events as well. So thank you all and have a great rest of your day.
Igualmente. Mil gracias.
Likewise, and thank you. Thank you so much. Yes.